Hello, everyone. It's Ande with your fertility specialist. Hi, viewers. It's good to have you with us on this Friday. To our Muslim fellas out there, we wish you all Baraka de Salah. Happy Salah to you all. We hope that you get the blessings and enjoy the blessings of the season. So, today, viewers, we're talking about painful periods. I'm your host today, Ruth Ogogo, and I'm happy to be with you. It's good to see you all once again. And we have with us today Dr. Jane Ojani. Dr. Jane, it's good to have you.
Thank you.
So, for the sake of someone watching for the first time, a bit about Dr. Jane. She's a consultant gynecologist, she's a fertility specialist, she's also a minimal access surgeon. So, it means that you're getting the right information from the right person today. We're talking about painful period. As we get started, call up someone, share this link with someone. We're live on all platforms, all our social media handles. So you could join on any of these handles. Call up someone, share the link with someone, and enjoy the show. Drop your questions, your thoughts, your comments in the comment section, and would definitely attend to them. So, Dr. Jim, we're talking about painful period. I think they will find out from you or abnormal, or when it's just to bear or seek attention. Well, I think maybe some might just, for someone that has not experienced period, they'll wonder, periods really painful. So maybe just a bit, what full period or how do people that period is painful? Is there something that they feel? Is there a particular pattern of the pain that makes them know that okay, this is menstrual cramps I'm having? Yeah.
Well, yes, painful periods are quite common. A
Okay.
lot of women would experience at one point in time in their lifetime would
True.
experience painful periods. And
True.
yes, it's in categories. So we have
Hmm.
or stages rather. So we have the mild form, severe form, and the moderate forms as it is. Yeah, so painful periods are not things someone should sit and manage. And you
Hmm.
know you're having painful periods because they are cyclical. They happen at about the same time every month,
Yeah.
just before or at the onset of periods.
Hmm.
So it repeats itself at the same time every, so we use the word cyclical to describe. So you know that those pains they are there and you know they are crampy. They come and they really they come and go,
Go.
something like that. So
Hmm.
you would understand that they are painful. Yeah. So but a lot of women would experience that. So there's the mild form that is normal,
Hmm.
but nobody should bear pains. So we'll now talk about what to do and where to get help from.
Okay. So viewers, hope you're learning something from this and you can relate to what this pain could feel like. So, is there a level of pain that there's normal? Because now you just mentioned that there's the mild form. So how do people know if they're having the mild form? Because people that have low pain threshold, they don't even want to feel any pain at all. So how do they know, or what to do with the mild form, what to do with the moderate, and then what to do with the severe? How do they know? And then when do they know that okay, what I'm going through is the mild or the moderate? So this is what I need to do. And
All right. So basically, painful periods for us in the gynecological world is classified into what we call primary and secondary
okay.
generally.
Mm.
So the primary one is when there is no condition attached to it.
Great. Okay.
So you
Mm.
don't have anything in the reproductive tract causing any disease
Mm.
associated with it. Now it's known that it's because of the uterus trying to empty the contents, like shed out the lining of the womb because
Mm.
of a particular chemical called prostaglandins. So
Okay.
some women produce more prostaglandins than others. So
Oh,
they
I
will
see.
experience more pain than
And
others. For
others,
the
okay.
primary one, while for the secondary one, we have a lot of conditions that could cause
Cause
all of
it.
those.
Oh.
Now, for the mild forms, yes, so there are that can go out this cramp, but there is no need to look
Mhm.
for pain medications, painkillers. They
Mm.
can go up.
Junction.
Then there are still women that I have this pain and I need something for pain. So you're able
Mm.
to take painkillers and you
And
feel
then
better.
better.
So you see, the mild forms also respond to painkillers.
Mm.
So when you start and you treat for like 3 months and you feel better, that is likely in the primary form, not
Okay.
associated with any disease.
Mm.
It's just Normally, those type midline, or will I call it central part of the tummy, where
Yeah.
the womb is assumed to be, because it's the squeeze effect of the uterus that is
Yes.
causing that pain.
I
So
see.
when you take pain meds for 3 months and or 3 to 6 months, and you see that for every month you need to increase the dose of your pain medication, for every month the severity is worsening and is now beginning to affect function, it's beginning to affect your sleep,
Yeah.
productivity, and all of that, then we know we are getting to what we call, probably you need to be evaluated. It might be a
True.
secondary form, and it's a severe form where you need much more pain medications like you would do in the first 2 days.
Wow. So viewers, we hope we're getting to catch a lot about menstrual pain and what is accompanied by it. Back then, before I got married, a lot of myth out there. Some people will say, until you give birth before you will stop having menstrual pain. Some will say if you have not had sex, you continue to have menstrual pain. You have a lot of myth out there actually. So you wonder, maybe you should tell us a bit about what causes this pain, because a lot of people have very wrong notion as to what will cause this pain. And then some of them, even when they have the severe form, because they have this notion that okay, maybe I have to bear this pain till I give birth, or I have to bear this pain until I have sex or something. People have that wrong notion. So maybe give us a bit about what actually causes this pain for some people, maybe those ones that have the severe forms now. What really causes this pain? Because I know you mentioned a bit about the prostaglandins that could cause the mild form and primary pain that some of them
Yeah,
have.
so the people that have the what we call secondary painful periods, or what we
Yeah.
call secondary dysmenorrhea, these people have a condition, or one condition or the other. So you could have commonly at when you see about 100 women with painful periods,
Yeah.
over 50 to 60 of them would have endometriosis. So
Wow.
endometriosis, adenomyosis tops the list for the common causes or
Hmm.
commonest cause of painful period. Then you have is some other person could have fibroids.
Hmm.
Yes, fibroids can also cause
Wow.
pain.
Hmm.
Yeah, so you can also have those with infections like pelvic inflammatory disease.
Oh.
Yes, people with sexually transmitted infections. Then people that have some growth like the ovaries, just down the pelvis and all of that. Then
Yeah.
there are some conditions that are not gynecologically related,
Related.
like
Okay.
reproductive tract related, like acute appendicitis, like infections in the bladder and all of that. Those things
Yeah.
can actually cause pain,
Hmm.
and for different reasons, those
Yeah.
conditions cause pain. Like for endometriosis, you know, just have those endometriosis like the chronic state. So as you are responding in the lining of your womb, shedding the lining, those
Yes.
abnormal tissues that we said they are not in the right place. So endometriosis
Yes.
is having the
Oh.
lining of the womb outside the womb.
Yeah.
So it can be anywhere,
Hmm.
just on the covering of the uterus. It can be in the ovaries. It can be just behind the uterus, in front of the uterus. So, and at those points, they respond to these hormones that are produced by
Moon.
the
Wow.
ovaries.
Wow.
So your body keeps reacting to them, responding to them.
Hmm.
So commonly, they will cause constant pain in the pelvis, and also these period pains that we're talking about. Same thing for adenomyosis, which is like an internal form of endometriosis, and it's for the same reason. They will
Hmm.
cause pain and all of that. For fibroids too, you can have fibroids just sitting out of the uterus. They can occlude the outlets of the uterus and cause increased pressure, increased pain during periods. Same thing, there are some people that have narrowing of the cervix. So
Hmm.
that can also cause pressure. So
Wow.
a lot of all of this commonly would cause pain in
Pain.
that form.
So viewers, hope we are getting this, and that's why, as a woman, if you are going through severe menstrual pain, you don't just sit and say, "That's how my mother's own was too," and it stopped. You don't just assume. You actually have to have yourself evaluated. So I'm thinking now, because I've heard a lot of people say this, that when they consume a lot of things, their periods are very painful. What do you have to say? Do you have a comment? Because it's a very common saying that a lot of men say. Some of them will say, when I reduce sugary stuff, the pain reduced, even though it's not completely gone. I'll say, this month now that I've taken a lot, I'm sure these people consume all the sugar in the world and they will don't have any pain. So does it have any relationship really?
Well, yes, so let's do some myths busting. So, like you mentioned
Okay.
about giving birth,
Yeah.
truly, there are some that have shown that early age at childbirth can help reduce menstrual cramps.
Wow.
So,
Wow.
probably that's why, formerly people get married early and all of
Mm,
that, have their first child. Looks like there is some
I
improvement. Yes,
see.
then, generally for every condition, there are people that are predisposed to one condition and they're like,
The
yes,
other.
will sugar cause painful periods? Yes and no.
Okay.
Yes, because now people that have predisposition and people that have a lot of prostaglandins will tend to have pain because
Mm.
the sugar generally will cause increased production of the prostaglandins.
Oh, I
Yes,
see.
but
Okay.
again, they are just extremes of everything. So you, like you
Mm.
said, some will consume a lot of sugar and they are
Nothing
fine.
happens.
So you
Yeah.
see, so it depends on the amount of prostaglandins generally that you produce that
Mm.
determines the pain you have.
So it's not, yes. Well, there's sometimes they say one rule of life is say know thyself. So if you've observed your trend and the way your body works, and you've seen that this is your psyche playing with your whole body, but if you've seen what works for you and you have believed it, and like Dr. Jane has let us know that okay, yes, there could be some form of there's a way that it could affect. So if you see that it affects you, then you might as well just sense and abstain from sugary stuff than go through severe pain. And if you feel when you consume all the sugar in the world, it still doesn't do anything to you, well, good luck to you. We hope it also doesn't have an aftermath much
And that's
later.
commonly seen with the primary dysmenorrhea. Of
Mm,
course, it's not, there's no hard and fast rule. So no
yeah.
take sugar, don't take sugar. It's just small, just a bit of okay, this can happen with lots of sugar.
Okay,
Not
so how do we manage these painful periods? Because you have a lot of people that sometimes this period even takes them from their day-to-day activity, like they barely can do anything. Back then when I was much younger, I had to deal with menstrual pain, and then my friends will laugh at me that if I'm like this on menstrual pain, how will I be able to want to give birth? But I wonder, does this menstrual pain and giving birth, even though people will say and labor is a higher form of menstrual pain, but some people will have severe menstrual pain that they've been bearing and they'll still shout very well when they're in labor. So you'll be like, I thought you've tested a bit of the pain. You should be able
so
to.
so the truth is that no one gets used to pain. So you feel pain in January, it doesn't change the fact that you're having severe pain in March.
Mm,
So
it's
no one
true.
gets used to pain. And for the same reason, what causes the painful periods is almost the same process that happens in labor. But for the
Mm.
cramps now, they are mild form. So some will say it's a very mild form of labor. Like let's say the labor is just about to kick off. Yeah, so because with the contractions, there's reduced oxygen supply and blood supply. So what we
Mm.
call hypoxia, ischemia, and those are
Mm.
the two things majorly that would cause the pain.
Pain.
So in
It's
labor too,
true.
you are contracting your uterus, but now you see labor is longer, the pain is more
Yes.
excruciating, and the
No.
baby is a lot bigger than the endometrial or the lining of the womb, those casts you are trying to expel. So for the management of painful periods, basically we can use medications, we can use drugs, and also there are extreme forms where we do surgical ones now. And
Oh.
those, and for the primary form, commonly we can do drugs. Yes, so now, but for the secondary forms, we treat depending on the cost of the
Close.
painful period.
Okay.
So for what we can do for primary period, which is very common seen in younger people, people less than 20. Yeah, secondary causes can be seen in people less than 20, but not commonly. And this painful period usually starts within the first 2 years of
Mm.
your period. Is commonly associated with ovulation. So it's when young
Mm.
people start ovulatory cycles that they tend to have all this pain. So what can we use? Pain over the counter painkillers, like what we
Oh.
call non-steroidal anti-inflammatory medications.
Okay.
So those things are the first line commonly used by all, and what they do, they block the pathway for the
Mm.
production of these prostaglandins, and
Okay.
that is how they improve your pain during periods.
Okay.
Then the and it's important that for people that have painful periods, it's shown that it's more effective when you take it a day before you
Oh.
start a day before the period and
Okay.
cover for
Mm.
like the next 48 hours
Oh
than
wow.
taking it when you need it. So your
Mm.
body builds up some painkillers, you're able to withstand, and by the time
The
it comes, you've
pain
already built a good concentration of the
of
pain
pain
medication
relief.
in your
Oh,
system.
oh, okay.
So for those that cannot take the non-steroidal anti-inflammatory, it's okay
Yes.
to take the conventional paracetamol,
Mm.
but it's more effective when you take those paracetamol that have caffeine in them. Then you can like the regular pills. Same reason too. So the pills would help the progestogen component of the combined pills would help flatten the lining of the womb. Remember that these blood pains are also associated for those that have longer periods and all.
Yeah.
So it now flattens the lining of your womb, reduces the amount of period and the bleeding that period, and that in its own way reduces the pain. And if you do that 3 6 months significantly, a lot of women will have improvement. And when there's no improvement, that's then you can also use just progesterone only. So you can have the only pills, you can have the injections
No.
and the intrauterine devices. So
Okay.
those are things you can use. Then of course we said it's contractions that causes this pain most of the time. So you can use things that can prevent, reduce your contractions. So like
Okay.
we use tocolytics,
Oh,
like the calcium channel, like some drugs we call calcium channel blockers. Yes, they've been shown to reduce the amount of contractions
contractions.
and
Okay.
help him. Then there are some drugs that, these contractions are like spasms, like
Mm.
shocks.
Yes.
So there are some drugs that are called antispasmodics. They can also be used to help to improve your pain. Then there's these other ones, what we call the GnRH analogs or agonists. They try to mimic what's going on in the brain and all of
Oh,
that,
okay.
desensitize the ovaries and all.
Mm.
So you can use that, but commonly use all of those in those with secondary cause of painful
Painful
period.
periods.
So now for management of those other causes, and that takes care
Uterus.
of your symptoms. For fibroids, same thing. You go ahead, remove the fibroids or remove the uterus, depending on the reproductive wish of the woman. For women that have narrowed cervix, you can open up. Well, that you will
Oh,
find on examination. Yes, you can dilate using different sizes. So the
okay.
period comes out easily, less pressure, less pain.
Pain.
So basically, it just depends on what you find from your on the client, what we call history, examination. Then when you evaluate, then you treat depending on the cause you find secondary
Okay.
dysmenorrhea.
So I just thought back to secondary school days. Back then when you have menstrual pain and you cry and go to sick bay, they'll not tell you wrap a towel around the hot water bottle and place it on your tummy. So I've seen a couple of people as a form of remedy. Some of them say they feel better. Do you have anything to say with respect to how that could actually help some people that maybe have the mild form and they don't take pain relief medication?
Yes, yes. So like we went to treatment. So there are some conservative things you can do,
Management.
non-medical management.
Okay. Mm.
Yes, using of what we call heats can
Oh,
improve that. Yes.
okay. Wow.
So when you apply heat over the site, remember we said painful periods are usually central. They are in the midline where the uterus is supposed to be.
B.
So
Mm.
the heat part help to increase blood flow. Remember we
Oh,
said the
that's how it works.
contractions reduces oxygen and blood
Yes,
supply at the
yes,
time of
yes.
that.
Oh,
So
I see.
that can be very effective for a very large number of women, and they wouldn't need
Wow.
medication.
Mm.
Yes, even mild exercises at the time of cramps. So you just distract yourself, move around. For those that have mild forms of it,
Yeah.
that would do. They don't have to take medications.
Remedies.
Yeah, so good sleep too helps. Remember, poor sleep increases your sensitivity to pain.
Oh, I
So
see.
that
Wow.
helps too. So
Mm.
just a bit of here and there. So some of these things help, but the heat part is very effective.
Okay, wow. So a lot of information on how to manage menstrual pain. Yes, I wanted to say I no longer have menstrual pain, so I've escaped the management. But back then when I used to manage deal with menstrual pain, I know it's a lot actually. I've seen a lot of secondary school girls. They really cannot even attend class. Some of them will even be throwing up, all nauseous. They are practically like, you just wonder, so if this person is like this, how would this person be in pregnancy? If you have to but they're practically, I don't want to say like vegetables, or almost they really can't do anything for themselves, just lying down. Sometimes some of them won't take pain relief, and some of them will say they've checked and they said nothing is wrong. So it's really something of concern. Yeah, I was also going to ask those people that have things like vomiting, nausea, and all of that when they're seeing their period. Is it normal? Because some people wonder that my own is extreme. No, yeah,
Well, there's nothing normal about painful periods,
periods.
but
Yeah,
it's a common thing that you'd find. So those
yeah.
that have nausea, that's the sensation of wanting to throw up, those that vomit, those that have diarrhea,
I
and all of
know.
that.
Yeah.
Basically, those are just effects of the same prostaglandins on the gastrointestinal system, or what we call
Mm,
the intestines. That's the
mm,
guts, right?
yeah.
Yeah, so it's just
Wow.
the effect. So
Mm.
you have these hormones, these chemicals, they are supposed to be, they don't just work in the uterus. Some can also get through the blood system, get to the circulation.
Yeah.
And so because of that, on the intestine or the guts, it increases movement of the bowels. So
Yeah.
causes the diarrhea, the
Mm.
effect on the stomach, the vomiting, and all of that. Even the hormonal changes, they also have headaches. Some of us, they
Yes,
are
that's
tired,
true,
and
and
all
all
of
of
that.
that.
These are just hormonal effects.
Oh God, a funny scenario just played out in my head. When you said the hormones can affect the intestines, and I just wonder, when people are tensed and then they start saying their tummy is paining, and the next thing they want to do. Well, that's me just thinking out. When you actually said the hormones affect the bowel and all, I just reasoned that, okay, those people too, that maybe they are very anxious, and
It
then the
can
next
just
thing
be
and all of that
increased
and all
in
that.
motility of the
Hmm.
guts, and that can happen.
So, viewers, I know that we've heard a lot about how to manage menstrual pain, and that's why if you're having this, you don't just sit back and say, "That's how it is, my family," or and just stay and bear the pain. Make sure you check yourself. Well, let's also ask this: Are there when would you think that someone should actually seek help when they have this menstrual pain? At what point do you feel someone should really go and seek for help? Because some of them, like I said, a lot of people feel like this pain is normal. So at what point would you say they should actually for help or get attention and be
Well,
sure?
so painful period, when they are not responding, so we did that from the introduction, you are not responding to the conventional pain meds and pills, or
Hmm.
you notice that every month you are increasing those, your symptoms are worsening, then
Hmm.
this pain starts to affect function, productivity. You are missing school because your period is around the corner. You are missing work. You are not found at your workplace once your period comes. That's severe form of painful periods, and you should seek help, because most times with this type of pregnancy, you have a cause which can be properly managed and
Managed.
improve quality of life. Yeah.
Thank you so much, Dr. Jane. So, viewers, a lot has been said about menstrual pain. I know that you've gotten something new from this session because there's a lot of way that you could actually know when you seek help, and don't just assume that this is how it is in my family. Just feel it's normal. Some people say,
Sure.
and then you just keep managing the pain when there might just be a secondary cause that could actually be, and you might not be pain anymore. So don't just sit and say everything is fine. When you have extremes of this condition, like she has mentioned, please do seek help, and seek help from the right place. Because some people just do very check and this is fine, and then you don't do thorough check, and then later on, like maybe they are now seeing issues that if you had known back then, they would have been able to probably prevent some of the things that you might see later on. And that's why, please, if you're seeking attention or seeking help from a healthcare practitioner, make sure you're seeking from the right source, like we have here at Alps Hospitals. Make sure you're seeing the right person, not just anyhow kind of doctor, because make sure you see a gynecologist when it comes to gynecological issue, and a good one if it has to do with fertility, a good fertility specialist at that. It's been amazing having you, our dear viewers. I hope that someone that is dealing with menstrual pain after this session today, I believe that you've been able to get new information as to how to manage the pain, and hopefully have a more productive life even in the course of your menstrual pain or menstrual issues. Yeah, before we wrap up, I was also going to ask, I've heard people say they have premenstrual pain. Some people say it's ovulation pain before the period even comes or after period has come. Do you have something to say with respect to that? Because you just wonder. Some of them will say menses has not come yet, they're already cramping, they're already having pain and all of that. So you just wonder, this pain is it around the clock something?
Yeah.
Yeah.
Well, so some women would have pain around ovulation. Yes.
Mm.
So during ovulation, what happens is that when the eggs, at ovulation, this egg comes from a ball like the ovary, so it just releases. So this space, like it's somewhere, even out from somewhere, is
Yeah.
left, and there's some drops of blood that
Oh.
irritates what we call peritoneum, the covering
Oh,
of the
okay.
organs in the tummy, so or in the pelvis. So that
Yeah.
irritation can cause that pain. So
Oh, I
that's
see.
mid-cycle pain.
Okay.
Now, before period, there's also this condition called premenstrual syndrome,
Oh,
or formerly called menstrual tension. So
okay.
it usually starts after ovulation,
Oh.
so in the what we call the luteal phase.
Mm.
So and it's just same thing, same hormonal balance,
Balance and all.
progesterone, estrogen, this
Mm.
drops, the other one rises, and it can come with a lot of symptoms. But commonly a lot of women will see that, classically you see them 4 days before period, and typically those symptoms disappear 4 days at the onset of period. So
Mm.
premenstrual tension can come
Mm.
with headaches. In fact, some persons are even pushing that should be categorized as a psychiatric condition,
So,
because it
wow.
can affect some people to the point that
Mm.
even relationships are lost at that time. They are very
Wow.
sick. I know that's why some persons complain that women during their period they act some kind of way.
Yeah, I
Sometimes these
know
women are
that.
just dealing with what they cannot control.
Yeah,
So you can
exactly.
have the breast fullness, the breast pain, feeling sad, feeling
Yeah,
unwell,
yeah, all of
and
them.
even those crampy response. So that's
Wow.
premenstrual syndrome, and it can happen. Yes, it's a condition.
Please, if you are seeing the moon right now, please give her a hug. Because women are going through a lot. Or dash her money. If once you dash her money, she'll be all right. We are going through a lot. Well, that's just on a lighter note. We really had a good time with you, Dr. Jane. And I know that our viewers also had a good time. And we've had new information from how to manage your menstrual pain to the causes and all that you can actually think of from menstrual pain. I know that we had a good time and I look forward to seeing more of you. Please stay glued to your screen. Just keep watching. Check our various handles. You'll see notifications when we have our sessions, when we have our videos drop. Just keep liking, keep watching, and have a good time. Have a lovely evening. Bye.